Gentlemen, we are live.
Great. Thank you everyone for joining us tonight. My name is Giulio De Angeli. I serve as an executive director here at AFIA. AFIA is a leading medical education group in Brazil, based on a number of medical school seats. We deliver an end-to-end physician-centric ecosystem that serves and empowers students to be lifelong medical learners. From the moment that they join us as medical students through residency preparation, graduation programs, and continuing medical education using a lot of technology. The objective today here on this event is that we are here to discuss best practices from different countries, countries that are ahead of Brazil in terms of when the pandemic started to spread. The idea came after several conversations that we had in the group with some of the professionals that are going to join us during this week. And we truly believe that the best contribution that we could do is to give back what we share and share this actually in a webinar format in Brazil. So we partnered with iHeed. iHeed is a leading online medical education company based in Ireland. And we put a series of topics and panelists for this week here. So we start today with resources and infrastructure for managing COVID. Tomorrow we'll speak about changes in medical education. Then on Wednesday, we will speak about the technology use on healthcare during and after the COVID-19. And the last day is more about the psychology and well-being of physicians, patients, and the wider population. So we want to use this week's discussion to help our healthcare professionals in Brazil on finding best alternatives for a country to fight COVID-19. So I wanted to, again, thank everyone for putting this together, for the participants, for our staff, our panelists, and everyone behind this. So at this point, I just wanted to mention that we have simultaneous translation for this event. So there are two YouTube links. So one for the discussion in English and the other one in Portuguese. So you can find the link below the video for the other channels if you want to switch. We'll be together over the next 4 days at the same time in Brazil. It's 7 p.m. here in Brazil when we start. And please join us next days and, let your colleagues, your friends come, since this is a free initiative. So just wanted to start introducing our co-hosts of this night here, who will be helping with the moderation of the session. So first, Dr. Tom O'Callaghan. So thank you, Tom, for being here. So Tom has been practicing medicine. He's a doctor, practicing family doctor, and one of Ireland's leading medical education entrepreneur. He's the CEO and founder of iHeed. It's a next generation medical education partner organization. And he's creating cloud-hosted mobile education programs for family doctors, pharmacists, nurses, and other community-based healthcare workers to improve patient care in Ireland, in Europe, in Middle East, in Asia, and Africa, with leading medical universities. Also, we have here with us today Dr. Rafael Munerato. Dr. Rafael is Brazilian. He holds a degree in medicine from Santa Casa de Misericórdia in São Paulo, residency in clinical medicine from the same institution, a residency in cardiology from INCOR, and a specialization in cardiac arrhythmia from INCOR as well, and an MBA in health management from FGV. Also, Dr. Rafael serves at the board of AFIA, and he's been involved with several discussions around COVID in the past months or so. I wanted to introduce our two guests for the night. So Professor Salman Rawaf, Professor Salman qualified in medicine with training in pediatrics and public health. He's a director of the World Health Organization, collaborating Center for Public Health Education and Training, and is well known for his international work and contribution to global health. He's an advisor of the World Health Organization on primary care, public health systems, medical education, and human resource for health development. Professor Salman's contributions to public health and primary care in research and service delivery are well known, and he's recognized for this work supporting countries to strengthen their health systems and service development, including Brazil. Dr. Brian Cheng also is invited for tonight, and Dr. Brian Cheng is the acting Secretary General of the Taiwan Medical Association and Honorary Secretary of World Organization of Family Doctors of the Asia Pacific region. He's a specialist in family medicine and community medicine, and he's been a director in a public health center for 11 years. So thank you very much for everyone to be here, Dr. Brian, Dr. Salman, Tom, and Raphael. So I'll hand the word to Tom. Thank you everyone for being with us.
Yeah, thanks, Giulio, and look, really appreciate being invited to join you guys tonight and to support Virgilio, yourself, and the AFIA team, and all of the faculty, Raphael, etc. You know, we are, as Brian said just before we came online, one global family as physicians around the world tackling this pandemic, and I think it's really important that we share the learning from countries that are perhaps a little bit ahead on the curve, and I think over the nights we'll have interesting insights from Singapore, from Taiwan, from Germany, from UK, Ireland, from the US, which may in some way help colleagues who are there at the coalface. I mean, I think we're going to start the discussion for about 15 minutes with Salman. And I think, you know, Salman is someone I have great respect for. He has been a great leader in public health and has seen many public health challenges in his lifetime. But this is a particularly challenging one. He's also a father to a doctor who's working in the NHS at the coalface as well. And he is working in Imperial College. He's been involved in a lot of the modeling and has recently published a very interesting piece in the WHO journal on the plans for opening up countries post-COVID. So I think Salman can give us some great insights. I think I just want to say one thing tonight is I know that there are Brazilian doctors out there who are perhaps feeling very vulnerable, feeling perhaps isolated and alone, overburdened with, I suppose, all of the challenges that are facing them, you know, having to change their practice to telemedicine, having to adapt to become part of a team, having to change their referral pathways, being worried about their risk of contacting COVID and infecting other patients or infecting their families. And I suppose all of these challenges are pretty overburdening. But what's great is that other doctors around the world have been through these challenges a month or 2 months ago. And what we've learned can certainly in some way be helpful to share those experiences. So really, I suppose, Salman, I'd ask you, the first question is the obvious question. What would we say to those doctors out there listening tonight in Brazil? You know, what encouragement and advice can we give them?
Well, thank you very much indeed. Thank you for the invitation, and hello, everyone. Wish you a good day and also safe days to come, you and your families. I think it's very challenging for all of us, especially frontline doctors. It's challenging for policymakers, it's challenging for people who are actually on the health service planning and decision making. It's challenging to politicians, but most challenging the people at the front line, whether they are in primary care centers or indeed in accident and emergency department or inside the intensive care unit where they receive the severe cases. So a lot of things they need to take into account. Number one, they need to protect themselves. Protecting themselves is not easy. This is not about only the virus, but protecting themselves from burnout, protecting themselves from being under such a psychological and mental pressure. It's not good to take care of people which you know about 50%, maybe more of them are going to die. It's not good to be in a situation where you know you don't have any treatment or effective treatment, or indeed a prevention like a vaccine or any other measures. So it's not that only the physical contact with patient and possibly the transmission. There are a lot of other factors. You need to take care. You need to understand as a physician, as a nurse, as anybody involved in this great health services, you are a great woman, you are a great man, you're doing a great job. You are saving the people's life, you are saving the institution in which you are working in, so it will continue to provide services for others. So I always say, I mean, this is the same advice I give to my son, who is in intensive care unit today, actually tonight as we speak. You know, you're doing a good job, great job, but we need you to continue to that, to provide such a good job. Take care of yourself.
Yeah, and I think that's great advice, Salman, and particularly for people to remain hydrated, take plenty of exercise, get sleep, and just deal with what's in front of them day by day, because you know it's a marathon, not a sprint, and it takes time. So what lessons have you learned in the UK that perhaps, you know, what success stories and what challenges have you had in the UK which may help inform our Brazilian colleagues?
I mean, this is always one of the greatest questions, what lesson we learned from the experience. I think initially, almost all European countries dismiss the possibility that the virus will reach Europe. Everyone thought that this is a problem which is confined to China, unfortunately. So despite, if you take the NHS and United Kingdom, we have fantastic preparation. We have incredible facilities. We have huge resources as the 5th richest country in the world. But yet they were taken by surprise with the magnitude of the infection and the intensity of the actually number of cases involved, especially in the initial stages. They were taken by surprise with the fatality. You see, initially we used to have something for those, as you know, most of the studies showing us clearly that about 81% of those infected, they tend to be either subclinical or mild cases. 20%, they need attention. Only 5% of those, actually, they need intensive care unit. And those in the intensive care unit, almost initially 70, 80% are dying. Now it's about 30% because we were learning step by step as we are moving in the epidemic. Secondly, I think we were not prepared in terms of personal equipment, some of the logistic, ventilators, not enough intensive care beds, because even that 5% were too many for one system, which is a huge system employing 1.7 million people, you know, to cope with. Yep. Number 3, primary care, we tried to protect primary care, you know. We did make it clear from the beginning, primary care need to be redesigned. I mean, happy to talk about that if you wish. Well, I think what we said, that for suspected cases, those are in contact with cases, please don't go to the primary care services. Please call them. Call your doctor or call 111, which is a specific dedicated line to make sure that patients who need advice will get advice before they can see a doctor. So that protection of primary care is important because continuity of other service, let us call it non-COVID service, are so essential because other people, they have life, they have also needs, health needs, need to be met. And primary care is the best institution to meet these needs, especially continuity of care, those with the chronic diseases, looking after children, mothers, antenatal care, etc. The list is so long that they need to continue these services. And the third point, which really it's important, where to get the advice from. There is no expert anywhere in the world in this virus. I mean, we were learning as the pandemic was progressing, and really this was a huge problem for the UK until they created and changed what called a special advisory committee advising them. We have also the technical advisory committee of WHO, which I'm one of those members. So we were learning as things were going on. And the fourth point it was really important for us, is how to diffuse the fear among the population. There was so much fear because they realized politicians were dealing with the unknown. Strategy tend to change from time to time, and that is worrying for the ordinary person in the street of London or Scotland or anywhere in the UK. And last but not least, I need to emphasize the fake news, the misinformation. There's so much, especially with the social media, and people actually transmitting a lot of fake news, including, unfortunately, some of the scientists, and we don't know why some of the things people just have experience with one patient, communicated as this is the golden standard of treatment. I mean, so far, as for today, all what we have, public health measures, I'm happy to talk about it. We were very successful in our public health measures. And secondly, all what we have for a treatment is supportive treatment. There is no drug which is saving life. There is no vaccine yet. There is no magic solution. And all the disinfectant mentioned by somebody else are not going to save life.
Yeah, no, I fully appreciate that. And in terms of the positive public health initiatives, what are the things that have been most successful that could be replicated in Brazil?
The public health measures were very clear and specific from the start, because these could be applied to any epidemic or pandemic. We can apply it to the flu, etc. Let me summarize it in a nutshell, in a few just a crispy point. I mean, number one was honestly the social distancing. Basically, this is part of the strategy to suppress the virus. Suppressing the virus, aiming at three things. Number one is minimize the spread of the infection. Number two, which is the aim of the suppressing strategy, is to save the health services. Because if you overwhelm the health services with large number of cases, it's going to collapse. And that's the last things you want. And the third and the last one is really to save life. By no infection, availability of services with spare capacity to deal with any increases. This is the aim of the suppressing the spread of the infection. And as you know, what we are talking about, bringing the curve, because in epidemic, the peak goes up, to the maximum, achieving what is called the herd immunity. So we are trying to stop that by suppressing and flattening the curve. It may lead to a second or a third or a fourth wave until we get a treatment or a vaccine, but it's rather I have it in a small wave than a big one, which is killing many people and make me unable to cope with the demand on the services. With this one,
Yeah.
we are successful.
Yeah, and what's been great is to see Europe beginning to open up now after the first wave. You know, most countries, other than a few outliers like Sweden and Romania, you know, are opening up, and that certainly is a positive development. Certainly, you know, we've seen the open up in Asia, but for our Brazilian colleagues on the call, to see that, you know, that wave will pass, the hard times will pass, and things will improve. But I suppose, Salman, when I read your WHO paper, what was really striking was your prediction of multiple waves, and certainly in the modeling that there could be 6 or 7 waves. I mean, what's at a practical level, is that what you anticipate, or what do you think will happen?
What one day we would unlock, definitely. I mean, the status of being in isolation and locking down on cities, locking down cities and towns, it will finish sometime. But that we need to make sure that 4 important things are happening. Number one is the issue of infection and the infection status. We put in that paper, and it's available to you, of course, you have it, and it would be great if you circulated it to
share it, yeah,
your network, to our colleagues in Brazil. Is that the infection rate, like the incidence and reproduction rate of the virus will come to 0, or even below 1, not necessarily 0. And the third issue is the doubling rate. The longer is the doubling rate, you see, in Britain, it reached almost about 1 day. Like a Tuesday, we have 300. On Wednesday, we have 600. But the best doubling rate is, of course, 0. But if you don't have that, 2 weeks or 4 weeks or longer, and then you feel a little bit more comfortable with that. The second area is about public acceptance. The public need to accept that certain measures will continue to restrict our freedom and our movement, whether we are restricted in using public transport in the way we used before, restricted in the way we are using restaurants and social places, and so on and so forth. It's not only that. We have to accept the economy of the world is going to be different in the next few weeks and months. Most of us now accepting that we may have lower income, a cut in our salaries. We may accept, you know, that some extra taxes will be imposed by government to maintain the economy, to maintain the social fabric of the country. They have to accept that schooling, examination will be different. You know, there are a lot of things like that. But the most important things, there are certain group of the population will continue to be under isolation or shielding or self-isolation. And this is in particular people over the age of 70 and vulnerable people with certain immunocompromised diseases or actually coronary heart diseases, etc. I don't want to go to the list, this list known to most of my colleagues. The third area is that your public health capacity is actually strong, and you make it stronger than before. If you look at in Wuhan, when they realized this is not pneumonia, this is coronavirus, within a few days, the Wuhan Health Authority, which is of course independent there, recruited 800 public health specialists to join them in Wuhan from the rest of China and also from outside China, including United Kingdom and United States. You know? And people, of course, traveled at that time quite easily. The fourth and the last area that before you unlock, you must make sure that you have sufficient capacity in your health services. Number one, that the hospitals, they have at least 20% spare capacity, especially in intensive care. that the primary care is ready, and in particular, to follow up these patients who were admitted to the hospital because of coronavirus and discharged from the hospital. We noticed these people continue to have some element of morbidity, either in the heart or the kidney or smell or variety of things. So hospitals cannot follow up them for a long period of time. So primary care is the best place setting to follow up these patients. All these capacity, your ambulance services, your volunteer, your this, and that.
Yeah, so pushing them back out into the community. Listen, Solomon, that's fantastic. And we might move on to Brian. There's so many other questions we'd like to ask you, and we can come back to talk about specific PPE and procuring equipment, I think, and the challenges around that. And we'll set up I suppose, a site with the resources, particularly that you put us towards. Brian, we'd love to hear about the experience in Taiwan. Can you tell us about how things are now and where you've come from and how you've got there?
Okay, I think it's very it's evening there in Brazil, and I want to say hi to everyone, and I'm very glad to be invited to join these webinars and to share the experience from Taiwan. I think I've learned a lot from the conversations between you and Professor Salmon, and the experience from UK, and I think we share much. Similarities in our experiences during control of these COVID-19 virus. And I just checked the news yesterday, and until May 4th in Taiwan, we have 437 COVID-19 confirmed cases, and 347 are people from abroad, and 55 are domestic. And we have consecutive 19 days, we haven't found any cases from the domestic. So I think it's a great news for us, and because we have
why is that, Brian? What's the success? What's the what's the secret success?
I think it's very we had this SARS attack at Taiwan in 17 years ago. And from the SARS, because SARS is more deadly from these compared with the COVID-19. And from the SARS experience, we learned a lot about early preparation of personal protective equipment. And after that, people are more willing to wear masks by themselves because they know they can avoid the droplet transmissions. And people are willing to clean the environment with the alcohol and detergents. That's what we learned from the virus. Step by steps, we learned that the coronavirus can be killed by alcohol. So after that, Taiwan has the alcohol washing machines before main buildings, if entering main buildings, so people would need to wash their hands with the alcohols. They wear masks. I think these habits for the public is very important for us in the very early stage of how we are facing these unknown virus. And I think Taiwan also has very good public health experience from the not just the SARS, but also the H1N1 flu epidemic in 2009. So we learned about how to early identification of cases and isolations. And the early measures from Taiwan to take is that once we very first know about the virus from Wuhan, like at the end of the December, and very first we started with the negotiating with the government to for the manufacturing of the masks. And then we are the medical associations in Taiwan and also the family physicians, the groups, we urge the government to do the border control. And I think the early border control is very important because we prevented of the cases to go into our communities. So it saves a lot of energy by I mean, the later on we have to trace the suspected cases, and it takes a lot of time and energy. But of course, we have some like some of the errors we learned from this, because in the early of January, we have this chartered plan. We want to bring back our people working in Wuhan, and we missed some of the infected cases. We let them go onto the plan. So that's what we learned from the very beginning, that we every step we have to do the screening before someone enters into the transportation vehicles. And the other thing is that we have some cruises on the oceans. We call it the Diamond Prince, the ship, and we have some travelers. They have mutual infections on the ship, and that is also what we have learned from. We have some cruising. We have Navy supply the ship. Also have some soldiers got infected. It's on the ship. So we're not for the border control. We learned from that. We not only have to control the passengers from the airplanes, but we also need to be aware of those ships. They're traveling on the oceans. So I think
it was people coming into the country from abroad, were a lot of the cases, and obviously your public health measures were really strong, and your use of those things. Brian, talk to us about PPE and your experiences with PPE and in Taiwan. Had you sufficient supplies? Were you able to manage? How did you?
I mean, the very first beginning, I think the public are also shocked and panic about this epidemic, and they're starting to stockpile things. And I think that's human nature. But with the lessons from SARS, we know that not only the masks, the food like vegetables and instant noodles, alcohol, detergents, and those are the people they need. So when it happens, only in a few days that the government, that they know they have to take over the production and distributions. So at the first beginning, we have daily product from 2 million masks every day until 6 weeks later, the daily production of the mask is 10 million. And so I think that is very important, the competence and determinations for the government to show the people that the government is going, they is going to lead the people fight against the pandemic. So I think people have trust in the government in the very first beginning because their actions on those PEPs, not only the mask, and later on we also have these these dressings and also for the negative bad preparation, something like that. So and the doctor is willing, the government is willing to trust the medical professionals, because we have these COVID-19 COVID-19 command centers, leading, of course, by the Minister of Health Department, but the consulting groups is leading by a very famous infection specialist. And also the team, we recruit those we have experts in the public health and community health. And together we have these daily press. We have press conference every day. We explain to the public of what we're going to do, and of the statistics we have in Taiwan, how many people got infected, how many are cured, how many have been quarantined. So people will not get panic about not knowing what to do. And as for these, the wearing the masks, at the very first, we said we do not have to wear masks, we just need to wash hands. But as the time progressed, as we learn experience from other countries, as we learn from the evidence of this virus, we advise people to wear the masks. when they're going to crowded places, when they take the mass transportations. And people are willing to listen to these experts because we only talk about evidence. We only talk about how to cure. Yeah. So
and
I
Brian,
think
was there strong healthcare leadership there in terms of messaging from the government level? Was there strong healthcare leadership?
Yeah, besides for the government, I think the leadership from the medical association is very important because I'm the acting Secretary General of Taiwan Medical Associations. This is, of course, the NGO of the NGOs, and we also have some groups from the primary health care. We also have district medical associations. Together, we have regular meetings discussing about the needs from the physicians in the communities, in the hospitals. We collect those questions from these doctors, whether it's for the PPEs, whether it's for how to dealing with the virus, and whether how to have health education to the public. And as for the medical association, we collect these problems, we negotiate with the government, with the command centers. And through this daily news press, we explain what's going on to the public. And we also let the public, also let the government know what they need to prepare for, not only to protect the physicians, but also to let the people know what is going to happen in the communities, such as that we do not go to the crowded place. We still not have the stay-at-home order right now, but we advise people do not go to crowded place in their. We do not go to we do not go to the pubs. Do not go to the movie theaters. Sure. If you want to go those places, you need to keep social distance, something like that. So I think the rules of the NGO of the medical education work hand in hand with the government. I think it's a very good example of what we do in Taiwan.
Thanks, Brian. Thanks. And perhaps we'd open up the discussion to Raphael and to Julio and any questions we may have from the participants. Raphael.
Yeah, for sure. Thank you very much, Tom. And Brian, Professor Salmon, thank you very much for having you with us. Brian, you mentioned something very interesting, that how much you learn for the previous infections. You mentioned SARS, for example. And do you think that those prior infections, they already changed a lot the medical practice, or do you think that the COVID-19 brings a whole new challenge? What you can share with us about the challenges that you already face?
I think the COVID-19 we learn part of the experience on SARS, but COVID-19 is quite different from the SARS because it's less deadly, but the contagious rate, I think, it lasts longer. So in the previous experience on fighting the SARS, we only need to check fever, and we have quarantine for those because in fever they have transmissions, infection transmissions. But as for COVID-19, whether it's fever or not, even the asymptomatic case patients could have transmissions. So we need to not only for the containment, but also we need to prepare for the community for longer fight against that. In that we are now the medical association is proposing a idea of the separation of the community patients. We try to separate those with acute symptoms and with airway symptoms from those with chronic ill patients, because it's a long fight. We have to separate, not only in the hospitals, but in the communities. And I think we also learned that from the Singapore. They had these preparedness clinics. So we need to give proper protective gears for those physicians in the community. They're willing to deal with those with airway symptoms. And while those who will have some doctors, they only take care of those chronic illness, because these are also the patients we need to face every day. And that's how we can get back to the normal daily lives. And we not only treat those COVID-19 patients. Yeah.
Julio?
Dr. Brian, I have a question here for Professor Salmon. I think there are a couple of questions here. There are several questions coming from the audience. But one of the, trying to summarize here in one question is basically, I mean, we are starting to discuss in Brazil alternatives and, to come back, opening sort of new services, we're still in this, in the shutdown of the country. But what would you say that it's, what are the alternatives, and what will suggest a proper transition to the, let's say, new normal? And I will focus here more on the healthcare system. So, I think this is quite important. Again, what is going to be the successful transition in your view? And maybe Brian could add to that as well.
You're on mute, Salman. Salman, you're on mute.
Well, thank you very much indeed.
No problem.
Thank you, Julio. The new normal will be different, and it's not well defined as yet. All of us saying a new normal, we don't know what is the new normal, to be very honest with you. We are dreaming of it. Each one is trying to define the new normal in his own sphere, and the life which he or she would like to adapt to. I think, first of all, if you are actually climbing to the peak, you have to take strict measures. The stricter the measures, the better. There is also a lesson which we couldn't do it in United Kingdom for a variety of reasons, mainly because of the political system here, likewise in Sweden and Europe. But other countries, I don't want to call them dictatorship or these names, these are meaningless. The stricter the measure, the better the outcome. And I mean it, I mean, in Italy, northern Italy, were a bit relaxed at the beginning. Look at the things what they done in Wuhan. And when we talk to them, I don't know how many times I managed to talk to my colleagues there, what they did, all cases were admitted to some sort of hospitals or hostels or indeed hotels. Whether it's mild case, once you have a suspected element of the disease, you are under observation somewhere. Because most of us, with the exception of the very few lucky in this world, they have enough space to isolate themselves. Majority of people living in multi-dwelling, and they are exposing themselves as other to a lot of risk. So that was one of the reasons they managed to control the peak of the epidemic at that time. It was in one area, is by treating everyone. Once your cases start to decline, control of the infection alone is not enough, i.e. the decline in infection is not enough. Other element, which we described in the WHO paper, must be ready, to partially open your, or ease the blockage of the towns and cities. That lockdown shouldn't be just open as if life is normal, You should take it step by step, in a systematic way, and testing whether the virus will re-emerge or not. Of course, all these will disappear if we have a treatment tomorrow. all these measures are meaningless if the vaccine will be available within a couple of months. But we know both these elements are not here. And that's why we have to be extremely cautious and wary that a single mistake may cost a lot of life.
So testing is a critical component of that, Salman.
Sorry, I missed your question.
No, I said adequate testing, ramping up the ability to test is obviously the critical component here.
I mean, we say this is under the public health measure and building the public health capacity. The more you test, identify, test, isolate, that process will continue. And I believe that technology will come soon, whether through applications or some kind of CCTV that identifying people with fever or they don't look well, in addition to the testing. You need to remember, Tom, that as for today, we don't have a test which is 100% sensitive.
Sure.
We still, I've seen a lot of patients which is tested actually negative, and the team were prepared to discharge because the protocol saying you should have another test, and suddenly the second test proved to be positive.
Yeah, there seems to be a lot of experience there. I mean, you've had the same thing, Brian, where you said testing one patient 7 times.
Yes, that's right. I also go with Salman that fast screening is very important. The detection of the virus in Taiwan, we at first we need 4 hours for the PCR, but until now we can do that within 1 hour. And I think in the near future we can maybe do that in fast screening, like in 15 minutes or so. So I think Brazil doctors need to aware of these screening techniques. Whether we have medication or not, because we have medications. When we screen positive, we just give the medication as we did in the H1N1 flu epidemic. But if we do not have those medications, we can isolate those people, identify those people. We can quarantine them or give them supportive care.
Yeah.
And the other thing I want to add is that I think people education is very important. Yeah. Because facing the unknown, if you have large scale community transmissions, all you can do is to protect yourself from being infected, yes. Protect your families, protect your loved. Yeah. So it's very important to give people the knowledge of washing their hands, wearing a mask if go to crowded places, and they have to keep social distance. I think these are very important knowledge for people to know and to practice.
I think so. I mean, there's been a lot of questions coming in on the feed around PPE, particularly availability of PPE. And I suppose the experience in an Irish context was that a lot of it was procured from China. And certainly a lot of health visors and masks were produced locally by industries that, repurposed and their companies to quickly develop those services. So I'm sure that's the same in Brazil, with a lot of ingenuity and industries working together to find quick solutions. The other thing in an Irish context was the availability of ventilators. There was a sudden surge in demand for ventilators, and there were planes sent to China to buy ventilators, and then the ventilators that came over, were inappropriate or didn't have the proper manuals or codes. So there were all these challenges, and then there were competitions between different countries outbidding each other on the private market to buy equipment. So there are a lot of those challenges around procurement. Just to answer that question, Raphael, do you have any, or Julia, have you other questions coming in there?
Yeah, I would like to learn a little more about the experience from telemedicine, because this is one of the huge changes here in Brazil in our medical practice. And we know that abroad, the telemedicine in their full spectrum is used by very longer. So if you could share with us if your experience with telemedicine has increased now with COVID-19, or what we could expect to add to our patients and to our practice?
Brian, do you want to take that?
Okay, so I go first.
Yeah, sure.
As we discussed with this very early because we have coming from abroad, we have 14 days quarantine. And for those who had chronic diseases, they need to see the doctors. So that's when we are thinking about telemedicine. And the first thing we do is we need the lawmakers to make all these go with the medical laws. So they changed they loosened some of the restrictions of the telemedicine just for these pandemics. So many people, patients, they have been quarantined with those diabetes, hypertensive. They can use the telemedicine equipment. Just use the, we use right now, we use the Zoom, or we use any of the mobile apps that could not need to have to face-to-face, I mean the virtual, but also with the sound recording of the medical consultations. As long as the patient is stable in medical conditions and with their family physician, they well know of their diseases, we can prescriptions like medicine for 3 months, even to 6 months. And the other thing is that we also have these national insurance to cover this telemedicine. I think this is very important for people. So this is what we are doing right now in Taiwan. Yeah.
Yeah, and we've had the same experience in Ireland, and I know the same right across Europe, is widespread adoption of telemedicine as the solution of choice at the primary care level to really drive consultations and reduce risk, and obviously then using remote prescribing and avoiding travel for patients to pharmacies, etc. I think, we're going to run out of time, so I'm conscious we need to finish at the end of the hour. There are lots of questions. I think, too many questions. I think it's very important that when we finish that, we leave on a very positive note. So I would like just maybe, Brian, your top maybe 3 tips and piece of advice to Brazilian doctors who are joining us tonight. I know over tomorrow and the following nights, we're going to talk about physician health later in the week. Tomorrow, we're going to talk about tracking apps and telemedicine on Wednesday night. But what would you like to say, your personal message to Brazilian doctors right now?
No, I think all doctors now are heroes. So you have to believe in yourself and stick in. And I think life always finds a way. So just be positive. I think everything will go away. And be sure to make sure you should protect yourself first before you're treating patients. Yeah.
And are you afraid, Brian? I mean, you've been at this for a long time. Are you afraid, or are you not afraid anymore?
Me? No, I'm not afraid at all. At the very first beginning. Yeah. It's our duty. It's our role. It's our core value.
Sure.
Yeah, we have a lot of students here, asking questions about, their role in this, the whole pandemic. And I mean, what would you tell them as well? Some of them are in the internship phase still. I mean, they're being recruited actually to be part of the, to be in front line. So how do you, what's the message for them?
I think it's a life experience to face this challenging time, right? We can practice not only the medicine, but also the public health. So it's very lucky you can become a medical student right now. You can learn, you can share experience, and maybe 20 years ago, 20 years later, you're facing another novel pathogens, and you can use your experience now to deal with the pathogens we're facing in the future. That's what we have in SARS in Taiwan.
I think you're right, Brian. I think that anything that does not break us makes us stronger. Salman, for you, what's your advice?
I think we are working with the unknown. As Brian said, all the medical people now, they are heroes because they are seen and perceived by the public as the savior. Those people who are saving their life if in any eventuality something happened to them. I think you need to be calm, number one. Number two, be yourself, have confidence. Most probably, and I don't say that lightly, most probably a large number of the doctors who were infected, they were not infected from patients, by the way. They must got the infection from outside rather than while they are taking care of the patient inside the hospital. The third point, which is, I think it's very important, don't cause harm, please. Yeah. So don't take risk on patients because your emotion, this is not about sympathetic attitude and drive your emotion to take a risk. You need to be empathetic and think about what you are doing. And the last, as Brian said, and I totally agree, take care of yourself. As I said at the beginning, because you are needed. We don't want you ill. We don't want you out of the circle. We don't want you to collapse because of the exhaustion or something like that. You are needed now, you are needed tomorrow, and working with other colleagues and all of us, we will beat this damn virus. I have absolutely no doubt.
Yeah, look, I think that's a fitting end to finish on. I mean, I think as a global community with colleagues all around the world, we all share one common hope for the future. We all want to care for our patients. And I know that the doctors in Brazil are full of compassion and caring, brilliant soccer players, great dancers, and we'll get back to all of that again, I have no doubt, in the future. So thank you all for participating tonight. I really appreciate it very much. And to Julio and Raphael, all the team at AFIA, to Solomon and to Brian. I think there are already resources that we would like to share. We can make them available online, guidelines, etc., particularly around those areas we discussed. And we can build those resources up over the course of the week. Thank you all very much, and stay safe.
Thank you very much.
Thank you.
Thank you.
Julio.
Thank you.
Great.
Thank you, Samuel. Thank you, everyone. And tomorrow we'll be here. Yeah, well, tomorrow we'll be here again at 7 p.m. in Brazil time. For you who is watching, tomorrow the topic will be changes in medical education. So invite your friends, your colleagues. I mean, definitely great discussions as this one. Thank you very much all.
Thank you.
Thank you.